And Andy and Paul, you can unmute yourselves. Andy, if you want to introduce Paul, and I know Paul's got some good stuff to share with us.
Well, I don't know whether Paul, since I'm on the council, I don't know whether he says yes because of that or what. It doesn't really bother me. I'm just glad it
doesn't hurt.
But Paul's just done a great job with our community paramedic program, and I think he spoke to us one other time, but I know that a lot of things have changed now, and I hope he enlightens us on those changes. Crawfordsville has been getting a lot of national attention with our community paramedic program. It was really a pilot program in the country, and Paul's just done a great job with all the guys down at the station that are involved, and it's just been a really good, just a really great program. And we've gotten a lot, like I said, we've gotten a lot of attention. And Paul, I've been around Paul a lot with his son and my granddaughter run cross country and track together. So we see him a lot at the meets, and Jenny, his wife, is a teacher here in the local, right? Is it Tuttle? Is she at Tuttle or at middle school?
Yep.
And she's a bundle of energy, and I'm sure Paul has a hard time keeping up with her.
That's why I have the gray hair.
Family and great family, and Paul and my son have connected through the fire service and chat sometimes, and so it's been a real nice pleasure to get to know him and his family. But I'll turn it over to Paul and fill us in on what's going on. Thank you for speaking today.
Yeah, thank you very much. Well, I like this setting. It's a little more informal, so I think I'll be able to share a little bit more of what we're doing. I mean, to date, we've got a lot of things that have changed since the last time you invited me here. But one of the things that hasn't changed is we're still regarded as the most advanced and progressive fire department in the entire country, providing community paramedicine. And you know, one of the things that I'm always excited to share with other communities as we're invited to go out prior to COVID is that Crawfordsville, while we're still a small town, we're consistently listed as one of the top 100 communities to live in. We've got a lot of positive things with a lot of powerful and connected people here in Montgomery County that seems to make business a little bit easier for us to do here at the fire department and kind of initiate programs like we're doing. But living in Indiana, living in Montgomery County, we have a lot of unique challenges being rural that other communities don't have. But what we see here locally is we have an OB desert. For our pregnant women that live in this community that are trying to have access to care, they're over 45 minutes to a birthing facility since 2013. Our senior community or anyone dealing with heart issues, we are an hour to 45 minutes away from a cath lab. Trauma care, we're an hour away. So we have to come up with unique solutions and really set our fire department aside from different communities. Everyone in our fire department is mandated to be a firefighter paramedic, which gives us access to a lot of different treatment options to provide better care in our rural setting. When we first started looking at community paramedicine, one of the things that we wanted to do was provide more holistic care and make our community a better place to live, work, and learn and play in. We know that healthier communities are higher earning communities. So we have to kind of attach this model of care that we're providing to economic development. And what can we do to fill the gaps in care to provide better support for our existing business and industry while attracting new business and industry to our community that wants to invest here because of the services that we offer that is unique to Crawfordsville, Indiana. Healthier communities are just higher earning communities, and we can provide better outcomes through more patient-centered, person-centered care. Right now, 30% of the total healthcare spend in the US, which is $750 billion, is on wasted or unnecessary services, poorly coordinated services and duplicated services. Our partnership with the hospital is meant to coordinate care more efficiently and better to provide better outcomes. Essentially what we're trying to do is called the quadruple aim of care. We want to meet our families where they're at, provide better experience of care, especially for the loved ones that are tasked with managing someone's health in the home that doesn't necessarily have the training or the supports, and reduce cost of care overall. So since, I'm going to say 2013, we've been providing different approaches to care. And while we initially set out to help our most loyalistic customers, which are kind of called our high utilizers on the 911 side, those top 5% of people that were utilizing most of our business on the ambulance side and the 911 side were accounting for 50% of the total healthcare spend in our community. But they weren't abusing services. They just didn't know how to navigate them. They didn't know how to use their primary care physician's office. They don't have transportation. They didn't have family supports. So with us going into the home, I think we would be able to provide a better impact and kind of change our model of care, what traditionally the rest of the country was doing with community paramedicine. So right now, we've began a new program, Dr. Box and a community member. I'm not sure if anyone's familiar with Dave McCormick, but he's the director of immunizations for the State Department of Health. We went to church with him at New Hope, and that's one of the things that makes Crawfordsville unique is how we connect and interact with one another. I think anyone that lives here is willing to partner easier because we seem to know each other, trust each other a little bit more. And we had an opportunity to present to the Department of Homeland Security and the State Department of Health a different model to make sure that people in our community and across the state could be immunized through flu vaccines and the rapidly approaching Pfizer and Moderna COVID vaccine. When I met with the State Department of Health back in September, only 17% of our kindergarten age kids were fully immunized and up to date on their shots. And 47% of all 6th graders and 12th graders were fully immunized and up to date. And this started back in March. When COVID shut us down, shut the community down, they also shut down a lot of our primary care offices, which made access to care a huge issue. One of the things that we're really proud to partner with the State Department of Health and our local health department on is being able to provide community paramedics and firefighter paramedics to our schools. We've been partnering with all 3 of our school districts and every one of our schools to make sure that they have COVID testing supplies in the school for those that are wanting to do it, and flu access. And soon we will be providing cradle to grave immunizations in our schools for all of our community members, teachers, and kids that need them to help make sure that we're all up to date on our immunizations. So that's pretty rewarding and pretty exciting. As far as I know, we're the only program or the only fire department that is partnering with a school district in this capacity. And since we've been seeing a lot of community spread with COVID in the last few months, it's been putting a huge strain on our local schools, the teachers, and definitely our nurses that are working in the schools. We've been allowing our firefighter paramedics to fill in our school nursing clinics when those nurses are out, so we can help in our own capacity keep the kids in person where attention needs to be focused on. The kids need to be in school as long as they can until we lose all resources. So the mayor has pledged, and Fire Chief Scott Busenbark has pledged our resources to help support our schools in any way we can. So that's another way that we are changing the expectation of care in our community to provide more prevention and more person-centered care. On the addictions front, since COVID hit, it's been very difficult. In May, we saw the same number of overdoses as we did in the entire year of 2019. Access to care is a huge issue still. People's lives still keep going on, people's troubles keep going on, and addictions have pretty much touched or affected everyone in this community, whether you're rich, poor, old, or young. Everyone has had a friend, a family member, or know of somebody that's been dealing with this issue. And what we want to do through our quick response team, or our QRT program, is to provide immediate access to care. We are the first fire department in the country to get treatment options for people dealing with addictions in the home. Medication assisted therapy is a very useful tool to treat opioid addiction specifically. And we have that access through Dr. Douglas, a local physician and a Wabash grad, that is really changing the expectations of care. And we're being looked at nationally. This year, prior to COVID, we had 13 different states that we were traveling to present our model of care and how we're facing addictions in our community and how we're providing better outcomes and pathways to get people into long-term recovery. Typically, everyone's been thinking that addiction is a young person's issue. There's a lot of stigma associated with addictions. They're seeing people as a 20-year-old male in a back alley with a needle in their arm. And what we're wanting to do is really kind of break that stigma. And at the fire department, we see addictions at every age, from cradle to grave. So we want to be a part of that care, be a part of that trusted member in our community to provide the services in home, whether it's a senior citizen dealing with addiction or dependency issues, or it's one of our pregnant mothers through Project Swaddle, to provide them immediate access and treatment options that are going to provide better outcomes and community supports for them. A lot of our program through our QRT program is following up on every one of our 911 calls for a fall in the home. Falls in our senior citizens population for our department is very high. Typically, we see 1,000 to 1,500 falls in the home that's utilized 911. We can do a lot as a firefighter paramedic to do follow-up services, make the home safe, and help that senior citizen age in place. Falls are extremely expensive when they happen repeatedly. One, they cause social isolation, make people less likely to go out and meet their friends, attend church, and go to different events. That can lead to depression and cause a lot of different issues. So if we can be in the home and support our seniors and do medication reconciliations and make sure it's not a medication error that may be causing someone to fall, we want to be a part of that community support. We want to be a part of connecting them with their primary care physician. And nearly 80% of social determinants of health affect someone's well-being and health outcomes. So if we can make sure people have rides, utilities, their medications, food, we can provide better health outcomes. And that's a lot of what our quick response team does. Another thing we do with our quick response team on the 911 side is work to find treatment options for people that have overdosed. So while typically in the past we've taken everyone to the emergency room after an overdose, we now have the availability to take people right to a detox or an inpatient facility, which will greatly reduce the cost of care and the burden on someone dealing with addictions, and provide more supports to the patient's family members, whether it's a parent, a grandparent, or a spouse. We provide harm reduction kits, safe use kits, so we can lessen the spread of hepatitis in our community, which if we looked into it, would probably be near epidemic levels, and in most communities because of IV drug use, and get those supports in place. Project Swaddle is probably our crown jewel, providing services in this community. Project Swaddle is led by Darren Foreman, who has been in the paper quite a bit recently. He was one of our firefighters that was in a pretty horrific accident and almost lost his life, but he's back at work and seeing patients again and providing better outcomes for our mom that are dealing with high-risk pregnancies, that are both socially high-risk pregnancies through addiction issues or clinically high-risk pregnancies because of genetics. So gestational diabetes, hypertension, and providing better access to care for our moms to get early access to prenatal care. This program's amazing. It's one of a kind. I've been reached out to in the past few months by Senator Brown in Fort Wayne who is really anxious for us to try to replicate the system in Parkview Hospital. And we're working with Franciscan locally to try to replicate this with United Healthcare up in Michigan City. So more moms have access to care like we're providing here in Crawfordsville. So that's pretty unique. This year, Project Swaddle has had 108 enrollments, and we've been able to provide care for these moms that are risked at delivering anywhere from 28 to 32 weeks, all full-term deliveries. Some of these moms have been dealing with addiction issues, whether it's been methamphetamine, polypharmaceutical use, or heroin, to a full-term pregnancy, and that's unheard of. We're providing better outcomes to really affect the governor's initiative of making Indiana the best in the Midwest. And currently, we're the worst in the Midwest, and we've just seen the first positive uptick in 100 years to our infant mortality and maternal mortality rates. So we're excited to be a part of that. We couldn't do it by ourselves. This is not just a fire department project. If we did not have the leadership at the hospital we have from Terry Klein, who is the CEO of Franciscan Crawfordsville, the support of our nursing community, our ACO, our primary care physicians, Dr. Douglas and Dr. Krummenacher have done so much to make us better in this capacity, providing us with one-of-a-kind training. There's so many things that are going behind the scenes in this community that it's hard for us to be everywhere, and that's why I'm so appreciative to be here with you, so we can really kind of pat ourselves on the back and let you know Crawfordsville is still the best place to live in, and give a lot more sense of community pride to the things that we're doing because of all the different supports we have here locally. A lot of communities that I've traveled to over the past 5 years all across the country are very envious of us being able to pick up the phone and being able to talk to our city council member, a state representative, or a state senator. And here, within the last 6 months, we've had a lot of correspondence here at the fire department where the governor's office is calling us and asking us for data so he can present at his press conferences every week. So I think we're doing a lot to be proud of and be very well connected. Another thing a lot of people in the community are probably unaware of is all of this has been supported and built either through Franciscan dollars or grants from the Indiana State Department of Health. I think we're pretty close to about $2 million in grant funding to help initiate these kind of programs and try to replicate them in other communities. And conservatively, we have been told that if every community acted in the same fashion that we do towards prevention, we could essentially avoid conservatively about $200 million in the state's Medicare or Medicaid funding. That's a huge impact. Every week of avoidance that we avoid in a NICU stay for our moms and families is no less than $150,000 direct savings, and less of a burden on a mom that may have to lose their job because of that pregnancy, that may have to go without a paycheck. The father, it's hard to care for a kid in a NICU stay. It's hard to bond with that kid. So a lot of different supports that we're doing that are non-traditional really need to be the expectation of care for every community. Right now, our hospital is very healthy, but across the country since 2010, we've seen 125 rural health hospitals close. Usually rural health systems are one major employer, and they provide a lot of support to rural communities to have access to care and better health outcomes. So anything we can do to help fill the gaps in care to provide a better business model for every one of our community stakeholders, we want to be involved with that, because at the end of the day, it just helps everybody. We've done a great job in fire prevention. We've done such a good job that typically our fire department responds about 10% of the calls, while EMS is taking up 80 to 90% of our total call volume. So it's just a different way to rethink our business model and not be confined with this is the way we've always kind of done it mentality and tradition. We're trying to stay ahead of the curve at every step. Our fire department should have been the first provider in the entire state to provide EMS in the country, but Indianapolis had a little bit more political pull at the time, and they became the #1 provider, and we became the #2 provider back in the 70s. So our department has always tried to do a little bit more, and it's something that kept me here. I've been on the department 22 years now, and when I moved to Crawfordsville in the 90s, I thought I was only going to be here 3 months until I went on the job in the city of Detroit, and I was going to be a big-time firefighter. And everything that we do here in Crawfordsville just seems to be better at every touch point. So it's something I'm very proud to be a part of this department and work in this community. But I would be happy to answer any questions that anyone may have about all the different programs that we are running. I will tell you, on our chronic disease program, we look at data of utilization of our patients 12 months prior to enrollment, all the way through 1 year graduation from our program. And we looked at our 127 patients that were enrolled in our chronic disease program. So someone dealing with heart failure, diabetes, COPD, pneumonia. Our 127 patients were utilizing the ER nearly 400 times a year prior to enrolling in our program. That's the most expensive place to be treated, typically through the most expensive taxi, which is an ambulance. Since they enrolled in our program, while enrolled in our program, those 127 patients only utilized the, excuse me, the ER, let me see here, I'm looking at the paper, 138 times. So down from 400 to 138, 12 months post-utilization, and kind of reinforcing the education that was partnered with the nurses, the doctors, and us. That utilization went down to 93. That's huge cost avoidance. That's better care. That's better outcomes and services. So that means dollars and cents right there. So thank you. I'm sure somebody might have a question.
Paul, thank you very, very much. Any questions out there?
This is Morris Mills. How are you restricted to the city limits of Crawfordsville, or what are you doing out in the county? Like I live in Ladoga.
So right now we're able to provide care to the entire county as long as they have a Franciscan primary care provider or a specialty provider. So if it was a cardiologist, let's say, but you were going to St. Vincent's, as long as you have someone affiliated with Franciscan, we're able to provide that care in the home. As long as you're not receiving nursing services, home health, or hospice care. Typically, we partner very closely with hospice and home health. So once someone completes their care with those services, they'll hand them off to us. So we partner fantastic with those different entities. And we've worked with Representative Brown and Senator Boots to pass legislation at the State House that will allow us to do this more broadly. I think in the future, as early as this year, there's more legislation being wrote for our community, or based on our community, that will allow us to do this more preventatively and outside of the realm, or outside of the walls of Franciscan. So this will be a billable and a reimbursable program to our department that will allow us to expand services while not increasing cost. So a big thing we want to do is make sure that cost is not a barrier to care. We don't want patients to have to pay for our program, but we do want people that are benefiting from it, like insurance companies, to have to pay their fair share, because they're experiencing a lot of cost avoidance and savings by utilizing us. But we don't want it to be affected. We don't want our patients to have to see it.
Paul, I know police departments are having, in small communities, are having a lot of issues with turnover, employee turnover. How is the fire department doing with that?
Typically, we were a revolving door. Being a small department, typically we were looked at as a stepping stone People wanted to get on Indianapolis. I myself, I wanted to be a Detroit firefighter. The last few years, especially since Chief Busenbark's been in, we have not seen that turnover. The mayor has done a lot to make us, prior to, we were one of the lowest paid fire departments in the state, and we're more competitive now than we've ever been in the 22 years I've been on. That's really helped slow that. There's a lot of pride in our department through our SWAT team, through our EMS programs, and our fire department. They're proud of where they work. They're proud when they see us get national attention and we're asked to speak at national conferences. So it makes them feel good, and it's really helped with our turnaround. So right now we just had a hiring process and interviews this morning, but we currently don't have any openings.
Good.
Paul, you might touch a little bit on the SWAT. You mentioned the SWAT team, about how it's kind of unique with our SWAT team.
Yeah, so
talk about it.
Our firefighter paramedics are fully integrated into our SWAT team. All of our firefighters that are on this team, the 6 of them that we have, are sworn in law enforcement officers, and they're a part of the stack. As far as I know, we are the only department in Indiana that's fully integrated with the SWAT team. That means they have the guns and they're a part of the stack. They go in on the entry teams, and they have saved multiple lives already with being a part of that team and protecting our police officers on a higher level. The services that we do with another local physician, Dr. Hessler, has changed our protocols and really advanced us medically in the fire service to provide chest tubes and just different treatment options that we wouldn't have had access to before. The way we work is probably more similar to what you would see a SWAT team operate in New York City or LA. They're the best of the best. They're just fantastic.
Yeah, correct me if I'm wrong, but beforehand, you basically, the paramedics were outside and they would have to wait till the scene was secured, and then they would go in and treat who was ever injured or during the SWAT entry. But being right there, it's like a medic on a battlefield. It's immediate.
It has really, I think, benefited us politically, working with the city police and the county police. We're brothers and sisters. I think we're as close as we've ever been in the 22 years I've worked in this community. They support one another, and they just have a better understanding of everyone's roles now. It's just all the leadership seems to be coming together over the last few years and meshing perfectly.
Well, one thing we got to remember, though, that the police department still eats more donuts than you do, and you guys eat more chili, right?
Well, I don't know. I think I could give our officers a run for their money if the right donuts were in front of me.
The other thing I wanted to mention too, before I get off, I was glad to hear you talk about Darren Foreman, and that he's back on the job and doing well. I was really glad to hear that.
You know, I just left out something, and now that I see his face, one of the things that you guys should all know is that the Montgomery County Visitors Bureau made a huge donation to the Crawfordsville Fire Department. Their old location, the Water Street and Pike Street address, was donated to the Community Paramedicine program. And we're there right now, rent-free, to be able to provide all of our community paramedic services in a handicap accessible building that is the only one I know of in the entire country. It's an absolutely beautiful building that really professionalizes the services that we're able to provide. Prior to that donation, we were stuck in a dingy basement with no windows, and now we're in just an absolute beautiful facility.
Hey, Paul. I was going to make sure that you let people know where you're located. What kind of training do the SWAT members get for mental health intervention when there's a crisis? Because I know that's been a flashpoint around the country. Folks with mental illness end up on the wrong end of a sheriff's gun.
Absolutely. So that's not something that's unique to people at any work phase. It's something that's been in our fire department, and that's probably something why, one of the reasons why we're so passionate. Addictions and depression has personally affected our fire department. We've lost family members in this space, so we do train on it. We have community resources that we reach out to as far as peer counselors. We utilize IFD a lot when we have very serious events, and our police officers and our SWAT team also are trained and have access to those resources to kind of help with that. We can reach out discreetly and privately to where there's a little stigma reduction, because our department our people don't even want to call in sick, let alone admit that they have a problem with depression, or that they're not looked at as being strong enough to deal with a hard case like a death or a traumatic incident. So we try to provide very discreet pathways to get them into services and get them the help they need. And we extend that to their family members as well. So there is a lot of state training. We're looking at some courses that Chief Busenbark was wanting us to bring to this community, but COVID had shut down a lot of these conferences and certifications and training. So we're hoping 2021, we're back on track with providing that outreach. But on the other side, our SWAT paramedics, our tactical paramedics, go through an additional 12 hours every month. And I think there was 80 additional hours of training for them to get law enforcement certified through the state of Indiana. So they do a lot of extra. On top of right now, I think we're at 4,000, just over 4,000 calls on the 911 side for the year. And probably that many for our community paramedic visits and calls. So our department, outside of the 911 call volume, is about 5,000 touches in the community, whether it's through fire prevention or community health. Extremely extreme. We are 3 times busier than any department our size.
Any other questions? Anybody?
Yeah, Paul, I had a question with reference to the information you were talking about regarding vaccinations and
Yes.
the low utilization percentages. Do you have any sense whether that is anti-vax or is it educational resources?
So there's a very small anti-vax community in Montgomery County. It's really that patients and kids were not able to get into their primary care providers' offices to get those immunizations and get them all up to date. Whether it was transportation or most of the visits being virtual, our school and our county has done a way better job of vaccinating our kids in our high-risk populations than most communities in Indiana. Our school nurses are absolutely fabulous. I believe our vaccination rates are 80 to 90% in our schools. When the state reached out to us and asked us to develop a program that would be sustainable, it was because of our success in all of our other programs and because of our high vaccination rates, that it was going to be easier to pilot a program to be replicated through our department. So that's one of those things that success breeds success. I think when I was meeting with some of our school nurses, anywhere from 80 to 100 kids in each of the district were not fully up to date on their immunizations. And that's where we'll try to provide better access to care through flu clinics in the schools every year. That will be free of charge. We will be working on kindergarten roundup with our schools, providing immunizations for families that want to utilize our services free of charge in the school when they come for kindergarten roundup, and not have to worry about taking a day off work to go to a provider's office. They can access our community paramedic building And we will be doing it again at the end of the year for our 6th graders and 12th graders, making sure that they're ready for 7th grade or ready for college with their immunizations. We're already offering it for all of our chronic disease patients. So at any point somebody needs a flu or a flu vaccine or a pneumonia vaccine, we've been able to do that. It's just one of the unique things that our fire department's doing to help keep people out of the hospital.
I have to say that your programs seem to be very innovative, and for the size of the community, I think it's outstanding.
It's amazing how many really intelligent people we have living in this community. We are so blessed with the doctors that we have in this community. The 2 doctors I work the closest with are both, no coincidence, physicians for Wabash College. So we have the best of the best in this community.
Speaking of given the vaccines and everything, why don't you update us a little bit quickly on the COVID stuff that you and I talked about earlier?
Yeah, so right now, we're waiting on the authorization and the disbursement. First will be the Pfizer vaccine. That's the 2-step vaccine process. That's got to be super cold, I guess is the easiest way of saying it. And then the Mondaro vaccine, which will follow pretty closely. It's looking like they've already got the 50 hospitals pre-designated where they're going to be distributing them to. And it looks like the first round of vaccines will go to healthcare providers. So our nurses that are dealing with this on the daily basis, and our nursing homes and our frontline workers, which will be our firefighter paramedics. And then we'll start working on a plan to get that out. That's one of the things that we're working very closely with the state to making sure that our fire department is a provider. We are the only fire department in the country that will be a vaccine provider. But looking to recreate that model, I just got done working on a guidance program with this Department of Homeland Security, where we're pushing that out to try to entice other fire departments to be providers as well, to do this in their community, partner with their local health department to where we can get access to the vaccine out there quickly for those that are wanting it. And I'll say there's a lot of misinformation going on regarding the vaccines and whether someone trusts the science behind it because it's been made so rapidly. I am not a physician. I am just a firefighter, but the people that I trust that are physicians that I work very closely with trust the science behind it, are able to explain it to someone as slow as me, that I feel confident and comfortable with receiving it. I have a mom that lives in a assisted living facility, and if it gets me to be able to visit with her on a regular basis, I am not scared to take it.
That's certainly great to hear, Paul. You know, it's amazing that, you know, my wife and I have only been in this community for about 5 years now. And, but just to hear what this department does and is able to do is fantastic. I've had to use the services, unfortunately, for a couple of times, and every time been treated very, very well and with respect. And I really appreciate the job that you all are doing. And
if they do not treat you with fantastic customer service, please let myself know, Chief Busenbark and Mr. Biddle. We will make sure that everyone understands. That's one of the things that we're very proud of here. It was taught and instilled in me from day one that we have a mother's rule in our fire department, and customer service is number one. The expectation of our community members should be very high, and they should always be happy, and we should be a good support for everybody on their worst day.
Yeah, they're fantastic. Thank you. Anybody else have any more questions before we close? Okay. We usually do a quote of the day, but since this December, I get to do a Santa joke of the day. So why did the snowman get kicked out of the grocery store? You got to unmute yourself to come up with the answer. Come on. Because he was caught in the produce section picking his nose. Okay.
I should have known it. We do
Thank you
jokes like that
all.
there's one guy at the department that does a joke like that every day, and I should have been prepared.
Well, thank you. And next
Thank you,
next
Paul.
week we will have the mayor on. You know, whenever Andy's on, we get all these big people, important people. So we're glad to see that. So next week will be the mayor. And until then, everybody stay safe, wear your mask, and stay at home.
Hey,
Most you
Gary,
can.
I got in touch with Chris Amadon and she's willing to speak on the 7th of January.
Thank you.
I forwarded an email to you with her response and my question to her.
Great, Chris, or great, Mac. I appreciate that. Thank you very, very much. That lessens my strain for January. Okay, anybody else?
Thanks, Paul.
Yes, thank you all.
Very much.
Andy, did you have
Thank you.
something?
Thanks for all you do.
I'm just waving goodbye.
Okay, thank you all. Have a good week.
Thanks,
Bye now.
Paul.